Hi, this is Hope Gully. I'm currently a nurse practitioner student at Auburn University, and today I'll be conducting a head-to-toe assessment video on my sister, Joy.
Hello.
So before we watch into the room, I obtained Joy's vital signs as well as her height and weight and calculated her BMI, all of which were within normal limits. Additionally, I tested her hearing, which was normal, and assessed her visual acuity using the Snellen chart, which resulted as a 20 out of 20 with use of corrective lenses. Additionally, before I talked to Joy about this assessment, she decided to defer on her GU exam as well as her breast exam. And since this video will be posted on a public forum, I will be lifting Joy's shirt only to inspect her abdomen, and I will do the rest of my assessment with her shirt and clothes on. So we'll get started. So just from looking at Joy, her general appearance is she looks healthy, her skin looks great, no like blatant scars or bruising that I can see. So Joy, I'm going to start from the top of your head and just move down. And we're going to also, I'll have to get you to stand up a little bit later and we'll assess some stuff, okay? So starting at Joy's head, her skin looks great, her hair is evenly distributed and it's nice and soft. So I'm going to start by just palpating your head and just for like any bumps or bruising or anything. Let me know if anything's tender. Okay. Nothing to note there, no dandruff or anything. Her hair is nice and soft. Her face is nice and symmetrical, and so I'm going to start with your eyes, and then we're going to go down from there, okay? So looking at Joy's eyes, they are symmetrical, and there's no like blatant scleral edema or scleral redness as well. She does have a little bit of allergic shiners under your eyes. Do you have any allergies?
Mm-hmm.
Okay. Pollen's awful right now.
Yeah.
So what I'm going to do is first I'm going to just kind of check your eyes and your sight, okay?
Mm-hmm.
So just follow my finger, okay? Follow this one. Good. Joy is great. I'm going to check your peripheral, okay?
Mm-hmm.
How many fingers am I holding up?
2.
How many fingers am I holding up?
3.
How many fingers am I holding up?
0.
Good. Okay. So now I'm just going to look in your eyes really fast, okay? So first I'm going to check Joy's her corneal reflexes, and then I will actually take a peek into your eye, okay? So keep looking at my nose. Okay. Her pupils are equal and reactive to light. And now I'm going to get you to cover your eye.
Mm-hmm.
Just one. Okay. And can you follow my finger? Good. And I'll cover the other one. And I'll follow my finger. Okay. You can take a nap. Alright. Joy's eyes accommodate perfectly. Nothing abnormal there. And now I'm just going to take a quick look into your eyes, okay? It might be a bright light, but I'll try to be fast. Okay. Sorry. Good. Alrighty. So, when looking in Joy's eyes, I could see her optic disc. She has a positive corneal, like a red reflex, and all of her blood vessels are normal in there. Nothing is dilated or busted or anything like that. So now I'm going to move on to your nose. So her nose is midline, nice and symmetrical. Her septum is midline, and she has, her turbinates are great. She has patent nares, and now I'm just going to take a quick peek, and I'm also going to test your smelling as well. Okay. Good. Any problem smelling?
Mm-hmm.
Okay. So her internal nasal mucosa is nice and pink. It's nice and moist, but there's no, oh my goodness, what's it called? Discharge. Okay, so now I'm going to get you to close your eyes and tell me if you smell something.
Yeah.
Okay, what do you smell?
Alcohol.
Okay, good. Awesome. So now I'm going to move on to your mouth. Let me grab a popsicle stick. So Joy's oral mucosa is nice and pink and moist. No chapped lips or anything. You need to open your mouth. Good. I'm going to look at the sides. No ulceration. Everything is nice and pink and moist. I'm going to look at your tongue. No scarring. No. Okay, and underneath, you can see all of her veins in her labium. That's good. And now can you go, good. I'm going to grab a light while I do that too, just to assess your tonsils. Okay. Now go, good. Uvula is midline. Everything's nice and pink, and her tonsils are great. Not swollen at all. Okay. And now I'm going to move on to your ears. So what we're going to do is I'm just going to look and then I'm going to look inside. Okay. All right. So her external ear looks great. It's nice and pink. It's movable. Her pin is movable. Her external ear looks good. And her tragus is firm, but I can still palpate it as well. Good. Do you have any ear pain at all ever?
Nope.
Okay. So now I'm going to take a quick look inside and then I'm going to test your hearing with a few conductory tests. Okay.
Okay.
Good. Okay, so I can see the mouse and the hammer as well, and then I can also see she has a positive light reflex, and it's that nice. Her tympanic membrane is nice and pearly. It's not swollen. Okay, she's a little bit of exudate in this ear, a little wax. She does have a positive. I can see the light at like the 5 o'clock area, and then her tympanic membrane is nice and moist as well, but it's not red, it's nice and pink. Okay, so I'm just going to do a few tests really quick. So the first one, I'm going to strike this and put it in the middle of your head, and you let me know if you feel vibrations, and you can hear it in both ears. Okay. Feel it in both sides?
Mm-hmm.
Okay. And now I'm going to strike the hammer and put it on your chin, and you let me know when you can stop hearing it, and I'll hold it up to your ear, and you let me know when you can stop hearing it. Okay.
Okay.
Okay, so tell me when you can't hear it.
No.
Okay, now tell me.
No.
Good. Do it on the other side. Oops. There we go.
No.
Oh, sorry. Close to your ear.
No.
Okay, good. So her web and rind tests were great. Nothing outside the normal limits. So what I'm going to do is just kind of test a few facial features, which corresponds with your cranial nerves. Okay, so can you raise your eyebrows? Good. Can you puff your cheeks out? Good. And suck them in? Good. And smile? Great. Okay, awesome. So now I'm just going to palpate your sinuses and kind of palpate down. And we'll go from there. Good. So let me know if you have any tenderness. Okay. That's her frontal, and this is her maxillary sinus. Any issues there? Okay. So now I'm going to look at Joy's throat. Her trachea is midline, and I'm just going to palpate down with your lymph nodes, and then feel your carotid pulse as well. Okay. Right carotid pulse is present. It's about 2+. And her left carotid pulse is present, about 2+. I'm going to feel your thyroid. Any tenderness? Okay. Trachea is midline, as I said. Good. And now I'm just going to feel your lymph nodes. Okay. And all of her subclavicular lymph nodes are now palpable, which is normal. That's a good job. So now what I'm going to do is just kind of test your neck strength and everything. So can you push against this way? Good. And all this way? Awesome. And now I'm going to get you to touch your chin to your chest. Like that. Perfect. And now can you put your shoulder to your chin? And to the other side. Perfect. So now that we've done the head and some of her shoulders, I'm just going to go on and get her to stand up while we're here, and then we'll move to the actual chair. Okay. Cool. So we're just going to test your musculoskeletal strength and everything. Okay. So can you put your arms out? Good. Behind your head. Up. Waist. Behind your back. Awesome. And then can you put your arms out? And then turn them up. Turn them down. Okay. Can you pull them up against me? And down. Good. Now can you put your hands up? Just going to feel your pulses. Radial pulse and ulnar pulse. Okay. Great. I'm going to just check your cap refill. Perfect. Okay. And then just for some extra, can you do it okay? Bear claw and wiggle. Perfect. I'm going to feel your brachial pulse as well. Good, nice and present. It's about a 2+. Okay, good. And so now while you're standing, we're just going to do a few more tests, okay? So can you walk for me about 3 steps? Good. Joy's a great gait. No imbalance. Now can you walk on your tiptoes? Great. No imbalance again. And then walk on your heels as well. Good job. I know it feels funny. Okay, awesome, awesome. And now if you can just stand on your tiptoes and go down, and then just a little squat, and do it about 3 times. Good. Now can you stand on one foot? Good. Stand on the other. Perfect. Okay, now put your feet together and just do 3 little hops. Great. Awesome. Okay, and yeah, that's good. You can go and sit on the chair. So I'm just gonna assess Joy's reflexes and then also assess her legs and her feet. So can you put your foot up? Raise them up. Both of them. Good. Now down. Can you raise them against resistance? Good. And push down. Good. Awesome. So I'm gonna look at your feet and I'm gonna keep your heels steady and you point them up, down, to the side, to the other side. Good. I'm also gonna assess your dorsalis pedis. Pulse, which is present, is about a +2, and then brachial. Good job. And then I'm also going to assess your popliteal while we're here. Good. Do the same thing on the other side. So I'm going to hold your heels still and point up and down and side to side. Good. No pain or tenderness. Okay. I'm going to check your pulses on this side. You've got some blisters. Yeah. Honey. Check your popliteal as well. Okay, awesome. Now I'm going to check her reflexes. So, oh, there we go. Okay, and now I'm going to check this. So just keep your hand nice and low. There we go. And the other side. Nice and low. Okay, great. Okay, and now you can lay on back. I'm gonna actually lay it down for you. Well, you can still sit on it. I'll just lay down. Oh gosh. I mean, you can scoot back to have your legs up. Yeah. Okay, cool. So what I'm gonna do is I'm gonna first assess Joy's heart. I don't see any like visible palpitations from her heart, so I'm gonna go on and grab my stethoscope real quick. Oh, it's on me. So. Okay. So I'm just going to listen in the zigzag formation. She's got her apical, pulmonic, and that Erb's flank, and tricuspid, and mitral. Good. Her heart sounds great. I can hear the S1 and S2 perfectly in all locations. There's no extra heart sounds or murmurs. And then I'm also going to assess your abdomen too. So I'm just going to look. Okay, skin looks good. There's no visible bruising or masses that I can see, and her navel is nice and it's facing inward. So now I'm just going to cover you up and I'm going to listen, okay? So starting from right to left, I'm going to listen to all 4 quadrants. Okay. Got active bell sounds in all quadrants. Great. Awesome. Nice and active. They aren't hyperactive at all. And now I'm just going to feel okay. So going from light to deep. Let me know if you have any pain, okay? Sorry, that's a question. Okay, any pain? And check for rebound tenderness. So let me know if this side hurts more, if this side hurts more when I just push in, okay? Does it matter? Okay, awesome. So now I'm just going to percuss really quick. So you're going to hear kind of dullness on this side from your liver, and then it's going to be kind of different sounds throughout. Okay. So from her midsternal line, her liver, from what I can estimate, is about, let's say about 7 centimeters or so from that right midclavicular line. I'm going to keep palpating. You hear your bone. any tenderness at all?
Mm-hmm.
Okay, and I'm just gonna get you to kind of do like a half sit up so I can see if you have any masses or hernias. Okay, good. No pain or anything?
Mm-hmm.
Okay. So finally, I'm gonna listen to her lungs and then I'm gonna get her to sit up and I'm gonna percuss the back of her, okay? Alrighty, so you can take a quick breath for me. Good. And one more. Okay. Okay. Alrighty, and if you can sit up for me. Great. So I'm gonna listen to Joy's posterior lung sound and big breath. Another one. Okay. All lung sounds are clear and equal. If you can take one more big breath, I'm gonna assess your chest expansion. Good. So Joy's chest expansion is nice and equal. I didn't see any retractions anteriorly or posteriorly. And the last thing I'm gonna do is just test for your sensation, and we'll be good to go. Okay. Cool. So what I'm gonna do is give you two familiar things in your hand. So there's a paper clip, a cotton ball, and a dime. So I'm gonna get you to close your hands, or close your eyes, open your hands, sorry, and tell me which one you have in your hand.
Cotton ball.
Good.
Paperclip.
Okay.
Dime.
Okay, and can you tell me which side is up, heads or tails?
Heads.
Okay, good job. And then finally you can put your hands down. I'm just gonna ask you if you feel soft or sharp on your face, okay? Great.
Soft. Sharp. Sharp. Soft.
Good. Alrighty. Joy, do you have any questions?
Nope.
Alrighty, and that concludes our head to toe assessment.